now we reach that point that I love to talk about, the rotation. Rotation in orthodontics, when you talk about this kind of movement, this specific type of movement in orthodontics, it is important because for that we have to have a different concept, which is a couple. The only way to have a pure rotation is imposing a couple to the structure, the body we are trying to move. So pure rotation can only be achieved with a couple, which is two non-collinear forces with the same magnitude, same direction, but opposite senses. Okay, and they are non-collinear, not the same line, because if they are at the same line, they will cancel each other. So in this situation, I'm having two forces, same magnitude, same direction, meaning horizontal, oblique, but different senses. Remember the tip or the head of the arrow? So this is what shows us the sense of the force. So we have two forces and different senses, okay? So I consider that very important in orthodontics because we have it in our bracket when we put a rectangular arch wire inside the rectangular slot. In this situation, we can generate a couple. So this couple is very, very important when we can control, when we understand and manage the controlling of this type of rotation, when we manage to do the control of the wire to impose the type of force we want in the direction and sense we want, so we can do many things in orthodontics. Trust me, I'm going to show it to you, okay? So rotation, before understanding rotation, I said that the only way to achieve pure rotation is with a couple. What is a couple? I showed you two forces in opposite direction, opposite sense. Actually, the direction is the same, horizontal, but opposite sense. We call it opposite direction all the time because it's easier. Opposite direction, we understand naturally, very visually what it means, but actually it's sense. So we have it 10 millimeters far from the center of resistance, equal distance in this example here. So let's see what happens. We have 100 grams in one direction. We see here above the center of resistance, and here below the same 100 grams and opposite sense, meaning we have two forces, same magnitude, non-collinear, not at the same line, and we have it in different senses, opposite senses, okay? So let's see how it goes. In this case here, we have force 1 and force 2. I'm going to say F1 and F2. F1 generates a moment 1. The moment 1 is 100 grams, same force, and we have this 10 millimeters. So we have as a resultant at the same thing as the moment 2, 100 grams plus times 10 millimeters height. So we have the same amount of moment. Since they are at the same direction, acting at the same direction, we had to add those moments. 1,000 grams per millimeter plus 1,000 grams per millimeter because they are the same direction. So we have, as a resultant of those two moments generated by this couple, 2,000 grams per millimeter. Okay? But is it, what happens with the movement in the sagittal or in the horizontal sense, in the horizontal reference? What happens here? As we saw before in the previous session, we can go with those arrows with those vectors and place those vectors at the center of resistance. The center of resistance here, we put 100 grams against 100 grams here, because for being a couple, we have to have the same magnitude of the force. For being a couple, it's one of the rules, same magnitude of the force. So when we apply those forces against the center of resistance, one force against the other, what we have as a displacement of the center of resistance. No displacement at all, because those errors, those vectors will cancel, will annihilate each other. So we don't have movement in horizontal aspect. In horizontal, uh, reference. We don't have it. So the only thing that we have in this kind of movement, this type of system, is the rotation. Meaning, since the center of resistance, it doesn't move. Remember the center of rotation calculation. Since the center of resistance is the point that doesn't move in this configuration here, the center of resistance is the center of rotation itself. So for having a couple, just a couple acting in one body, acting in this tooth here, one of the premises is that the center of resistance is the center of rotation. No movement at the center of resistance. Okay? But you can now be asking, so is this the only configuration in which the center of rotation is the center of resistance? Meaning I'm applying the same magnitude of the force at the same level or the same distance between the center of resistance and both forces? No, it is not. It is not. Regardless of the point in which you are applying the force here, it doesn't have to be 10 millimeters. It have, for both of them, you can apply at different height. You will have the same outcome. Meaning, in this situation, to simplify, to make things simple, I'm gonna show you the same amount of distance. Okay, so in this situation here, I'm sorry, not the same amount of distance. I'm sorry, I'm having 10 millimeters. I'm having numbers, easy numbers to do the calculation, just that. So I have here force 1 acting 5 millimeters higher than the center of resistance, and force 2 acting 15 millimeters below the center of resistance. So I have it here, and if I separate to do the calculation, I will do like this. Moment 1, I know that the force will cancel each other. They will be canceled. We have here the magnitude of the moment resultant will be in one direction, in a clockwise direction, 1,000 grams, okay? Or 100 grams, I'm sorry, 100 grams here, times this distance, which is 5 millimeters in this example here, and we have the force 2 generating the moment 2 of moment is force 100 grams also plus 15 millimeters. 15 millimeters plus, times 100 grams. So let's do the calculation here. We have in one direction 500 grams per millimeter, and the other direction, and not the other direction, but in the other moment, same direction, other moment, we have 1,500 millimeters. They are acting in opposite sides related to the center of resistance, generating the same moment, the same direction, as you can see. So, since we have the same direction of the moment, remember, we have both are clockwise direction moments. So we need to add those moments. 1,500 plus 500 grams per millimeter. So we have now 2,000 grams per millimeter. When you see this image here, there's something that's very clear for us. In all examples, the magnitude of the couple depends on the magnitude of the force, which are equal forces, and the distance between the two forces. It's easier to calculate that way. We don't need to calculate one and then the other one. We just need to calculate the force and the times the distance between those two forces. The same thing always. So I don't need to do one calculation of the moment related to the center of resistance and then the other calculation to the other moment related to the center of resistance. I just take one of the forces that, for being a couple, if they have to be equal, one force times the distance between those two forces. The same thing always. So now we have this possibility of doing the calculation. Okay? So what if I do now the two forces applied at the same side related to the center of resistance. Will it change anything in my system? No, it won't. Let's do the calculation for you to have this in your mind. For example, here I have still doing this isolated calculation, one moment and the other moment. And then we go with the calculation I just taught you. In this case here, one force 100 grams, applied 5 millimeters from the center of resistance, but now we have something different. We have now a counterclockwise moment. So if I do this and calculate now the resultant in comparison with the other moment, which is 100 times 15 millimeters, we'll have this resultant. But now I need to consider one of those two moments positive and the other one negative, because they are acting in different directions. I'm not adding them, 1 plus 2, 1 plus 1. No, I'm not adding 1 plus minus 2, 1 plus minus 1. So this is the way we compare, because they are in different directions now. So now we have the first moment is 100 grams plus 5. Second moment, which farther from the center of resistance, 100 grams times, I will say plus, this times 15 millimeters. So now we have those two moments. I will consider the counterclockwise moment as a negative moment and the clockwise moment as a positive moment. So I have minus 15 grams, 500 grams, sorry, plus 1,500 grams. As a result, and now I have 1,000 grams per millimeter over in this kind of situation, but I have one direction, which is the direction of the higher moment. So we have a 1,000 grams per millimeter of a clockwise moment. And what if we do the way I taught you before? What if we do like this? Huh? And if I change the point of application of the force, what happens? Now I'm not pushing, now I'm pulling from buckle side. Doesn't change a thing. It's the same thing. Changing the point of application of the force along its line of application or of action, it does not change the effect of the couple. Okay? So let's do it because it's easier for us now, because we can do that. It's becoming more and more easier, because this is the way we act in orthodontics. We put a force in the buccal or lingual side. We can do, of course, in different sides, but we usually do at the same side. So we do this. It's easier for us now to understand. And shortly we're going to another aspect that will change everything. Okay? So here we have those two forces apply at the same side again, but what can we do now? We can change the direction of the moment if we want to change the direction of the resultant. Now, let's see it before. We have it in this direction. This is a moment that is a clockwise moment, okay? So we have it here, a counterclockwise moment, okay? Because we have now those two directions acting. I'm so sorry. Let me go it again for you to understand, because I myself, I'm confused with so much errors. Let me go it again. So we have here this, and the resultant moment is the moment that is in this direction, a clockwise moment, because farther from the center of resistance of this and this system, okay? So now we have this other concept, which is changing the point of application won't change a thing about a couple. So now we have this couple acting in one side and having the same outcome. If I want to change the direction of the moment of the couple, it's necessary to change the sense of the forces. Okay, I'm changing now the direction of the couple, just changing the sense of the forces. What is the force resultant that we have here? Now, the resultant moment here is a counterclockwise moment, because what drives my attention here is this, the farther force from the center of resistance. Okay? let me go now to another concept that will make everything clear for us, why I'm talking about it so much. This is the next concept we are using now. So a couple is a free vector. It can be moved anywhere on the body and have the same external effect on it. So what did I do here? I just changed the couple and put the couple acting inside the slot. What is the force that generates this kind of moment, this kind of couple? What is the configuration that we have in orthodontics that moves this, that changes this, that can act inside the slot? A rectangular arch wire twisted inside the slot will generate two forces in opposite directions, same magnitude and non-collinear. Okay? Easy now, huh? Now it rings a bell. Wow, this is what I'm going to use when I use, for example, retraction, or I want to change the inclination of those crowns. Okay? So, as you can see, these two forces here acting in this body, because the bracket is attached to the crown, now it makes just one body. And as you can see here, the higher the moment generated here, the resultant moment is always related to the fire moment, the moment that is more distant from the center of resistance. So which moment is more distance from the center of resistance? This one here. And it goes upwards. So when I bend the arrow, when I bend the vector around the center of resistance, I see that this is the moment that is generated in this system, is a counterclockwise moment. Counterclockwise moment, okay? So now we have the resultant force here is, what is it? If I calculate that separately, I'll have 1,000, which is my example. As we see that the distance between those two forces now are very are decreased, short distance, very short. If I want to have effectiveness in this situation here, I have to increase the force. I need to increase the force. And when we talk about the equivalent moments, when we talk about the force during the retraction, we will understand how we calculate this. So this moment here, this couple here, generated here, can be calculated like this. 1,000 plus 1,000 times 6 millimeter, the higher moment, and 1,000 times 5 millimeters, the lower moment. And the higher moment is counterclockwise. So what we have here, we have this difference, which is 1,000 grams per millimeter. And if we just calculate one force times the distance between those two forces of the couple, we'll have the same outcome. We have 1,000 grams per millimeter, because I'm calculating the resultant force just using the one force times the distance between them. Okay? Same thing. 1,000 grams per millimeter in this direction, which is counterclockwise. Very good, huh? So now we can understand that we can do this using this torque. I'll have the same outcome, meaning I'll have the rotation with the center of rotation being the center of resistance. Is that correct? What do you think about it? What do you think is that we have when we apply the force in our continuous arch wire mechanics? What do you think? Well, just to initiate a different discussion here, because sometimes we think about something and we just think about that and we don't consider other things. So we know that our rotation, a pure rotation is only achieved when we use a couple. But let's invert this. Can we have a pure rotation applying a couple using this concept of continuous arch wire mechanics? No, we can't. Let me show you how it goes. So pure rotation is not easy to have in this situation. Why is that? Let's see. Now we have a couple, because we have two different inclinations, one of the long axis of the rectangular arch wire and the long axis of the slot. So now we have a couple generated inside the slot. A couple, as you know, is a free vector. So it's supposed to generate a rotation with the center of rotation being the center of resistance, a pure rotation. So is that what really happened in this situation? Let's see. Well, for that to happen, we need to have this. Note that the rotation of the tooth with the center of rotation located at the center of resistance requires the crown to move downwards and distally, similar to the movement of a pendulum. Yeah, let's center the pendulum of the movement in the center of resistance, which is supposed to be the center of rotation. So if I had really a pure rotation in this situation, the crown needs to go downward and it goes distal. Is that possible when you have this configuration here? Is that possible when you have the contact points, one touching another, and we have this? The contact point restricts distal movement of the crown. So sometimes we think that this is what we had in the theory, but when we go to the practice is not the same thing. Another thing that needs to happen to have the center of rotation being the center of resistance is that the center of rotation, it doesn't move. For that, the crowns need to go backwards, need to go distal. Do you think it is possible? Just putting this here, configuration here, you just push all teeth, not for the center of rotation to move? Well, I don't think so. And another thing here, the anterior teeth would need to undergo relative extrusion. Remember the pendulum. This is what happens if I put the center of rotation in the center of resistance. It needs to go downwards. So, do you think it is possible using a rectangular arch wire to have this kind of configuration? No, it is not. So this is probably what we have. The wire stiffness and the small interbracket distance will limit vertical movements. No, we won't have the extrusion as they apply there. So what's going to happen? These restrictive factors change the center of rotation when a pure torque is applied, transferring it closer to the brackets of the anterior teeth. So in fact, what's probably happening here, the center of rotation is here, and we have this outcome. It may be very bad, huh? If we have proclined teeth and periodontal losses. If we have our patient, which is very common in our patient, the patient have periodontal losses where it is very, very common to be to the anterior teeth to be proclined. The repercussion may be very, very bad. So beware. So be aware of this. Take care. Understand what you're doing. We'll talk much more about this because this is very, very important. So guys, this is what happened in this situation, okay? And we need, just for finishing here, to understand that this couple can be related to the first or second order movements. We can have couples in first and second order movements, although we always consider a couple with third order. I don't know why, but we are going to mention those couples both in second and third order and first order also, okay? So, see you soon. I think we now are done with this kind of basics, and we're moving to another kind of concept, which is applying this in a clinical, in our clinical practice, okay? And we're going back again, when we go to the retraction, when we need to clarify certain aspects of our movement, we go back with this kind of concept, and when we enter the realm of the loops, we have to go further in our biomechanics concept. We are going to do that. Okay? So see you soon. Bye bye.